addressing the Black Maternal Health Crisis. I'm your host, Sister Akila. This program was created to raise awareness and provide solutions for Black women who suffer most from the current maternal health crisis. On today's program, we're answering the question, are Black girls really dying from pregnancy? That question sounds simple, however, the answer is kind of complex. So let's start with a little background. What is maternal health? What does it mean to die from pregnancy? Is there a crisis? If so, how bad is it really? When someone says maternal health, they're talking about the health, the well-being of a woman while she's pregnant or immediately after being pregnant. There's women's health, which covers our health from adolescence or puberty through menopause when we lose the ability to have babies. And there's maternal health, which is all about our health when we're pregnant or just after being pregnant. Maternal health is a thing because the body goes through a lot of major changes really quickly in pregnancy. Think about it. There's only 9 months from conception, when the baby is made, until delivery, when baby is born. Now, if you've ever been pregnant, you already know them last 2 weeks feel like 9 months all by themselves. But in reality, it takes less than a year to go through the entire process of pregnancy. And while baby is going through a lot of changes in this process, our bodies go through big changes too. Maternal health deals with the body as it's going through those changes and as it returns to quote unquote normal. So when people talk about the maternal health crisis, they're talking about the fact that women are expiring while pregnant or within 1 year of being pregnant. Black maternal health is the same as maternal health with a particular focus on Black women. Well, why is it necessary to make that distinction? The maternal health crisis affects everyone, true. However, Black women are dying at rates much higher than white women. Not only are our rates as Black women higher, the causes of death are different. Since our condition is unique, that condition requires a unique focus. So there's 2 facts that I want to share that I believe give great perspective on the Black maternal health crisis. Fact number 1, according to the CDC, Black women die from pregnancy-related causes at a rate nearly 3 times that of white women. Fact number 2, in some cities, like for example Chicago, Black women die at a rate 6 times that of white women from pregnancy-related causes. Just off those 2 stats alone, it's easy to see that the situation is definitely at a crisis level. So to answer the question, are Black girls really dying from pregnancy? Yes, we are. Here's the thing though, our condition is not hopeless. The Black maternal health crisis is very much preventable. And not just because I feel strongly about it, the data actually backs it up. Let me pull up 2 reports that show what I mean because I want y'all to see what I'm talking about. The first report is from the CDC, which is a national agency that studies maternal mortality, also known as pregnancy-related deaths. The data in this report comes from the MMRCs of 36 states. I don't know what happened with the other 14 states, but we're gonna work with what we have. MMRCs, or Maternal Mortality Review Committees, are committees made up of professionals from different occupations that study pregnancy-related deaths at the state or local level and pass that information to the CDC. The CDC compiles the information from those MMRCs, and from that, they can get a picture of what's going on nationally with maternal health in the U.S. As you can see, there's a good amount of data here, and we'll definitely be revisiting this report to pick up some additional information in our upcoming episodes. For today, I want to focus on something from the key findings. That very last bullet point reads, over 80% of pregnancy-related deaths were determined to be preventable. Now, from here, we're going to scroll down to page 5 of this same report, and I want to show y'all 2 important definitions that they've included that will help us to understand what it really means when they're reporting that over 80% of those deaths are preventable. It reads, quote, pregnancy-related, a death during pregnancy or within 1 year of the end of pregnancy from a pregnancy complication, a chain of events initiated by pregnancy, or the aggravation of an unrelated condition by the physiologic effects of pregnancy, end quote. So when we say someone died from pregnancy, we're saying their passing was pregnancy related, meaning they had a pregnancy complication like anemia or diabetes or high blood pressure, or their passing could have been from a chain of events, meaning more than one thing happened, but the first event can be traced back to the pregnancy. Or they had an unrelated condition. For example, the person could have been diabetic and then they got pregnant and their pregnancy aggravated that condition, that diabetes. The second part of the definition reads, in part, these deaths are causally related to pregnancy or its management. And that management of pregnancy is really where we have a lot of opportunity to put in the work to turn this crisis around. Let's look at the second definition. It reads, quote, preventability. A death is considered preventable if the committee determines that there was at least some chance of the death being averted by one or more reasonable changes to patient, community, provider, facility, and or system factors, end quote. Then it goes on to explain how the MMRCs document preventability. The decision is broken down into two parts. The first part is a simple yes or no. The second part, was it preventable based on their definition of preventability, which means one or more reasonable changes to patient, provider, community, facility, and or system factor. Then they put it on a scale that indicates whether or not there was any chance, whether or not there was no chance, some chance, or a good chance. The report continues, any death with a yes response or a some chance or good chance on the scale is considered preventable. Quote, deaths with a no response or a no chance were considered not preventable, end quote. And that is a reality in pregnancy. Some deaths are not preventable. However, I want you to think back over the fact that we learned that the study shows that over 80% of these pregnancy-related deaths are preventable. So when we're talking about the Black maternal health crisis, we have to keep at the forefront of the conversation the preventability of it all, right? The fact that it is preventable. It doesn't have to be like this. Why is that important? That's important because this crisis requires that we take action, that we do something different than what we have been doing, because what we have been doing is not working for us. And the numbers and the time are in our favor, but the responsibility is on us to act. Now, let me pull up the second report, which comes from the state of Illinois, since I mentioned the fact that Black women in Chicago have a mortality rate 6 times that of white women from pregnancy-related causes. As you can see here, this is the state of Illinois Maternal Morbidity Review Report, and it was released in October 2023, so this is their latest report. We also plan to revisit this one in the future too, so be sure to stay tuned. For now, we're going to focus on one point, which is in their executive summary, found on page 9. They report, quote, the MMRCs determined 91% of pregnancy-related deaths were potentially preventable due to clinical, system, social, community, or patient factors. 91%. Now stay with me, because we're going to go back over that definition of preventable from the CDC, because I want to highlight something there, right? I have an idea of what preventable means. You have an idea of what preventable means. But the CDC, based on information from those MMRCs, they've come together and they've determined what preventable means as it relates to maternal health and the maternal health crisis. So I want to highlight here where it states, quote, one or more reasonable changes, end quote. Reasonable, not drastic, not outrageous, reasonable. When I read that, I said, you know what, let me look that word up, because I need to be sure I understand what I'm reading, and I want to make sure I understand the data and what it is they're really saying when they're reporting this. The first definition I came across for reasonable was common sense. I cannot stress enough that our suffering from this crisis can be greatly reduced and prevented by our making just one or more common sense changes. I don't have to do too much. You don't have to do too much. We don't have to do too much. We just got to make some reasonable changes. And that's what On My Mama is all about. We're here to educate you on the reasonable changes that can be made to lower these numbers significantly, because each one of these numbers represents a person. Never forget that each number, each statistic, each percentage point represents a mom, a sister, a wife, a friend. And each one of these losses has a rippling effect in our community. We got to turn it around, y'all. We have to turn this around. And it starts with us knowing what's actually happening and then taking action steps to prevent it. So, what can we do? I got 3 easy steps. Step 1, get informed. Learn what you can about the Black maternal health crisis, especially if you are a Black woman or if you know Black women. You don't have to get a doctorate degree. But if an article about Black maternal health comes down your timeline, please take a moment and read it. Step number 2, make a plan. If you're pregnant, if you want to get pregnant, even if you've had a baby within the last year, find out what you can do to increase your chances of survival. We've created a guide, I have it here, oh, there it goes, that details some reasonable changes that we can make in those areas, those 4 areas that we talked about, right? Facility, provider, community, system, and patient. That's actually 5. But we've created a guide that's in full color. I'm going to open up to the table of contents so y'all can see for yourself what it's about. The book goes over, here's chapter 1. The book goes over how the maternal health crisis is affecting us as Black women. It talks about different settings where you can have birth, which is facility, right? Chapter 3 is all about some of the challenges that we face. And then chapter 4 is about postpartum. We've also included a glossary in the back, and as you can see, it's in full color. It's very easy to read. It's a small book, and it's a very easy read. And like I said, we have included a glossary in the back because many times there are words that are commonly used when we're talking about something, right? And you don't want to be learning about something when you're in the delivery room having contractions. That's not a recipe for success, okay? So say, for example, when we talk about being induced, you may be told during labor or during delivery, hey, you need to be induced. Your pregnancy is not, or your delivery, your labor is not progressing, and so we want to induce you. You don't want to learn what that means at that moment. You want to have an idea of what that is beforehand, what the benefits of the procedure are, what the risks of the procedure are, and if that's something that you want to agree to do or if you want some more information. The point is to get knowledgeable, be informed, and make a plan. And most importantly, if you've had a baby within the last year, or you know someone that has had a baby within the last year, one of the things that we've included in the guide are the urgent maternal warning signs. These are signs of a potentially life-threatening complication that are often ignored until it's too late, okay? We'll go a little bit more into this on the next episode, but one of the things that I was heartbroken to learn was that women and their families don't know about urgent maternal warning signs. And when we don't know about them, we tend to dismiss them, right? And full transparency, I didn't know about them until I started down this process of learning and collecting data about the maternal health crisis, okay? And I've had 2 children. So no one knows about them, or it's not widely known. And I'm by no sense the standard. However, no one I've talked to knows about them either. So a critical part of us changing the Black maternal health crisis is us learning what those urgent maternal warning signs are. Why? Because when we don't know what they are and we don't feel like ourselves, we may not realize or even accept that there might be something wrong. So by the time we actually go and get help, our condition is too far gone for the help that's available to be effective, okay? So it's important to learn and know these urgent maternal warning signs so you can get medical attention when it's needed. Be a friend, learn it for your friends who are pregnant or who have had babies. If you're pregnant or plan on having a baby, you need to know what these urgent maternal warning signs are also, okay? The guide is available on our website at kiyamawellness.org. Again, that's Kiyama, Qiyamah, wellness.org, and I'll post a link below. You can also preview the book there so you can see if you find the information valuable before you purchase. You know, it has a couple pages in there that you can actually read from start to finish, so you can see if you believe the book is valuable and something important and helpful to you. And then lastly, step 3, support. When you see people talking about the Black maternal health crisis, support us, like our videos, subscribe to our channels, post and repost our information, donate to our cause if you can, because we've got to do all that we can to bring awareness, attention, and resources to this crisis. All right, y'all, the first episode is in the books. Thank you so very much for making the time to watch this video. I am humbly honored that you would take the time to listen to these few words, and I pray sincerely that I've said something that you find valuable and that you feel is useful to you and that you feel is shareable also. So until next time, that's it. Thank you. Peace.